there a better time of the day when you change your appliance?
I think early in the morning, when I haven't been drinking water all through the night.
Okay.
You are preparing to change the pouch for Mr. Marcus, who has a non-continent urinary diversion. Important variations in pouching procedures result from the continuous flow of urine. For example, placement of a pouch can be more difficult because urine flow keeps the skin moist. Also, a patient may have a urinary stent in the immediate postoperative period to keep the stoma open, and the stent can be difficult to pouch. Consider the following questions in your planning to pouch a non-continent urinary diversion. What is the location and condition of the stoma? What type of pouching system is used by this patient? For example, is there a stent in place? If so, surgical asepsis must be followed. What is an appropriate schedule for changing pouches? Remember, ureterostomies drain continuously. An accumulation of urine in the bag can pull the pouch away from skin. What is the condition of the pouch and skin? Be sure to check the pouch for leakage and length of time in place, and ask your patient about skin tenderness around the stoma. Supplies needed for pouching a ureterostomy include a pouch with a urinary anti-reflex flap and skin barrier, measuring guide, bedside urinary drainage bag, disposable gloves, sterile gauze pads, paper tape, scissors, and skin sealant wipes.
Because that urine comes out all the time, it's a good idea to have this ready. You can use gauze, or you can go ahead and use part of a paper towel at home. What we do is we roll it up. That's a wick. Now what we can do is hold that wick, and that'll help soak up that urine when it comes off.
Wash your hands and apply a pair of disposable gloves.
Now, what I'm going to do,
gently remove the old pouch.
Take off the appliance, and when I do that, I'm going to hold the paper tape, and I'm going to push your skin away. That's much safer for your skin.
Observe the urinary output from the stoma.
All right, now we need to measure that since you're in the hospital, so we'll put that away carefully.
Inspect the condition of the stoma. A ureterostomy stoma is normally moist and red or pink in color.
Very healthy. And you've got a nice beefy red stoma. It's what we call well butted because it sits up real well like a spigot. And it's flowing very nicely. You know it's working.
Cleanse the skin around the stoma with warm water. Wick the stoma continuously with the gauze to keep the skin dry.
Place the rolled gauze over the stoma to prevent leakage of urine onto the patient's skin.
And your skin looks very nice. Okay,
then,
that's great.
Measure the stoma and prepare the materials for a new appliance.
So I'm going to have you lift that away. Oh, this is excellent. Your stoma is at 7/8. And here, I'm going to give you another one. Do you want to just hold that? That's great. They give us a starter hole, but we're going to have to make that a little bigger. So what we're going to do is put this on and mark this just a little bit larger. And what we're going to do is cut that opening a little larger. Going to cut it on the outside of that black line. Now, before I take this paper off, I'm going to check and make sure this is the right size. So I'm going to have you lift up. Oh, that looks great. That's wonderful. Now put that back. Very good. That's excellent. Now, before I have you take that off again, I want to show you something special about these bags. They're called anti-reflux. You can see the little one-way valves in the bag. And what that means is if I put my finger inside, the urine can only go one way through these valves because there's really two bags in one. So when you lay down, the urine goes into the down and comes up in this upper bag, and it doesn't flush back over your stoma. And what we're going to do is take off the backing. I'm going to pat it, make sure it's very, very dry, and then put the appliance on. And you don't have to hold it anymore. It fits beautifully. Very nice job.
And that'll stick without any kind of an adhesive or.
The adhesive is in the bottom. It's that pectin wafer. So you want to put your hand down. You can just relax now. Now this has got a ridge and this is a lip. So what I want you to realize is to get this on, you want to match up that lip and that ridge, and you want your thumbs and fingers to be touching underneath here.
Does it make a noise when it clicks?
Sometimes it does.
I
Is that
heard
it? You like
I heard-
that sound?
Yeah, that, for an engineer, that kind of
Right.
helps.
Now to check to make sure it's on, give this a tug.
Oh, no, that's something
Yeah,
I
so
wouldn't
you
dare
can-
do. Yeah, that's all right.
Yeah, you can do that. Now, if you had to take this pouch off, you could hold it by the tab and take the flange part and pull down, and it'll come off very easily. But then again, we want to make sure when we put it back together that we push every piece of it together. Nice, even. All right, now that's on, and let's take off the backing paper. On this flange, they have two places, the top and the bottom across each other, where you can tear it on a perforation so that you can just take that appliance off. The paper tape comes right off and the appliance stays. We don't want to take the appliance off. There are belt loops that we can use to put an ostomy belt on to make sure that it sits
Added precaution.
as a precaution. A lot of times that's a good idea to do for the first 20 minutes after you've had it.
It may be more convenient for nighttime drainage to connect the system to a bedside urinary bag.
During the day, your appliance looks like this. It's even on both sides. There's no yellow dot. That means no urine can fall through it. When you wanted to empty the urine, you would twist it. Now, if you were just feeling with your hands, it would feel uneven, and there'd be a dot to let you know that urine will fall out
Good.
through this opening.
Easy way to remember.
Yeah, that is handy. Now, something that what we need to do, though, at nighttime, or if you're taking a nap during the day, because you make urine all the time, this holds about what your bladder does. And this needs to be emptied about every hour and a half to 2 hours. When it gets to be about a third full, it gets heavy. So if you're going to sleep, you're going to want to connect it to bedside drainage. Every manufacturer's pouch comes with some sort of adapter. This one snaps over that little lip. To put it on, to take it off, you just push the sides in and wiggle it off. Then we can get a bedside drainage bag. And it's a good idea to hold on to this cap so that you can plug it up if you need to. This will adapt the pouch to where it hooks.
That has a lot of capacity then too. Then.
It does, you know that. Now this, here in the hospital, we hook it on the side of the bed. At home, you may want to get a small trash can, hook this, a clean one, and you would hook this inside the trash can and put that next to your bed. That way you won't kick it at night or step on it, and you won't worry about it not being clean. This you have to clean out every morning. You need to, when you take this apart, shake to make sure all of the urine runs into the tube. Turn off the pouch so now it's closed. Separate it. And then if you have your adapter, you can close it up and you don't have to worry about any germs getting in there. Do you have any questions about any of this?
No, that's very clear.
When pouching is complete, help Mr. Marcus with comfort needs and discard soiled supplies and gloves. Document your assessment findings and the procedure in the nurse's notes. Record the type of pouch, time of change, condition of the stoma, volume and character of urine, and the patient's response to the procedure.